Within the walls of ASU's Biodesign Institute, scientists have developed a simple blood test that can tell if a woman has breast cancer.
We were looking for something in the blood that would reflect the presence of a cancer at its earliest stages, because we believe the earlier we detect it, the more likely we are to treat it effectively.
Dr. Josh LaBaer had been working on this approach for nearly 20 years when he met researcher Karen Anderson.
We were interested in understanding how the immune system was seeing breast cancer.
In musical terms, it was like Lennon meeting McCartney, a perfect collaboration. LaBaer and Anderson both believed by tracking the body's immune response, they could detect cancer in the body long before the patient exhibits symptoms.
We're using the body's own emergency alert system, which is the immune system.
Since 2003, they've been identifying proteins produced when the body fights cancer.
The immune system starts to see those changes very early, as if it was a virus.
With thousands of proteins in the body, the trick was pinpointing the specific ones that would indicate breast cancer.
So we looked at 10,000 proteins and we came up with 28 in our initial test. After
nearly 15 years, they narrowed it down to 13 marker proteins. This is the result. Videssa Breast, developed by Provista Diagnostics, a simple blood test.
We call it a liquid biopsy because the idea is versus another biopsy where you need maybe, a scalpel or a needle to open the tissue and take the tissue out. We just draw a tube of blood. We get the results back to the physician within about 5 days.
When a mammogram detects an abnormality, the Videssa Breast blood test can rule out cancer, eliminating unnecessary biopsies.
It's a tremendous amount of expense to the system. It's a tremendous amount of time for the woman. It's very inconvenient, can cause a lot of anxiousness, anxiety. This is what we want to reduce. If you prevent one biopsy, depending on which part of the country you're talking about, you can save somewhere between $1,100 and $1,500.
Videssa Breast can also pick up cancers a mammogram might miss.
We want to catch everybody who has cancer, and we don't want to put women under the knife for surgeries they don't need if they don't really have cancer.
And for more than a third of all women who have dense breast tissue, mammograms don't work well identifying tumors. Lisa Cook knows this all too well.
I have to continue to go for mammograms, and I continually get an abnormal mammogram, which means I have to go back for an additional mammography and ultrasounds.
The simple Videssa Breast blood test gives her peace of mind.
I don't have to worry about the fact that, wow, is this cancer or is it not cancer?
For Dr. LaBaer, the search for a better test is personal. He lost his own mother to breast cancer.
Certainly, if we had caught it much earlier, if there had been a blood test that had picked it up early, who knows?
And who knows where this search for tumor protein biomarkers will eventually lead in the early detection of many cancers.
We are getting better and better at treating this disease, and patients are living longer with it. It doesn't always make it go away, but it lets them live longer with healthier lives.